As we age, regular health checkups become part of the routine. However, many seniors are unaware that some of the tests they undergo may do more harm than good. It's not uncommon for older adults to be advised to take tests they don't need, which might lead to unnecessary treatments or even serious side effects. New research reveals that a significant percentage of medical tests on seniors result in complications, unnecessary procedures, or lifelong issues. In fact, a shocking number of seniors, particularly those over 70, are subjected to tests without fully understanding the risks involved. It's time to expose the truth behind these commonly recommended checkups and reveal why you might want to think twice. Before scheduling certain tests, these checks, while seemingly harmless, may be putting your health at greater risk than you realize. Here are 6 health checkups you might want to avoid after turning 70, based on real-world studies and cases. First, let's talk about the bone density scan. It sounds like a harmless procedure. After all, it only involves a quick scan to assess your bone health. But the reality is that this scan can often cause more harm than good for seniors, especially those who aren't at risk for fractures. The bone density test, also known as a DEXA scan, measures bone strength and is commonly used to diagnose osteoporosis. However, many people over 70 are subjected to this test, even when they show no symptoms. Bone loss is a natural part of aging, and minor reductions in bone density aren't necessarily indicative of an osteoporosis diagnosis. Studies indicate that most seniors who receive medication for mild bone loss do not see a meaningful decrease in the risk of bone fractures. Take the case of Helen, a 78-year-old woman who had been leading a perfectly active life and never suffered from any bone-related injuries. She was referred for a DEXA scan during her annual checkup, and the results showed a mild reduction in bone density. Her doctor immediately recommended a treatment with bisphosphonates, which came with a range of side effects, including severe reflux and jaw pain. After taking her off the medication, Helen resumed her normal activities, including hiking, with no further issues. Lifestyle changes, like weight-bearing exercises, proper nutrition, and sufficient vitamin D proved to be far more beneficial than medication. Next, consider the brain MRI for memory loss. Many seniors start to worry about memory loss, especially as they age. When forgetfulness becomes more apparent, a common response from doctors is to recommend an MRI of the brain. However, brain MRIs often reveal nothing more than normal, age-related changes, such as mild shrinkage or white matter spots. This can lead to unnecessary anxiety, invasive follow-ups, and even surgery. Research shows that in over 80% of cases, where older adults undergo MRIs due to mild memory complaints, the results are inconclusive or show age-related changes with no actionable medical condition. For example, Jim, a 72-year-old retiree, started forgetting names and misplacing items more often. Worried about Alzheimer's, he underwent an MRI, which revealed some white matter changes. Fearing the worst, he became anxious and withdrew from social activities. But after a cognitive screening, his scores were well within the normal range. The MRI findings were simply a result of aging, not a neurological issue. His doctor helped him focus on improving his memory through lifestyle adjustments, like regular sleep, mental exercises, and hydration. Jim felt much better, and his memory stabilized, without the need for unnecessary procedures. Now let's talk about cardiac stress tests. Many seniors are advised to undergo a cardiac stress test when they experience symptoms like mild fatigue or shortness of breath. This test, which involves walking on a treadmill or being given medication to simulate exercise, is intended to uncover potential heart problems. However, after age 70, stress tests can be more harmful than helpful. For one, the false positive rate for these tests can be as high as 40% in seniors. This means that a significant number of people are wrongly told they have a heart issue, leading to unnecessary tests, medications, and even surgeries. Take the story of Frank, a 74-year-old, who complained of feeling slightly winded when walking up hills. His doctor suggested a stress test. The results showed some irregularities, prompting further tests, including an angiogram and the placement of a stent. But Frank's symptoms were never heart-related. He simply needed more rest and hydration. He spent days recovering from the procedure with no improvement in his energy levels. His experience highlights the dangers of unnecessary cardiac stress tests in people without clear symptoms of heart disease. Fourth on our list is colonoscopies. Colonoscopies are routine for seniors to screen for colon cancer. But after age 75, they might not be necessary unless there are specific symptoms. The risks associated with the procedure increase with age. For one, the preparation involves strong laxatives that can lead to dehydration, dizziness, and kidney complications. The procedure itself can also cause bleeding, bowel perforation, or heart rhythm disturbances. Studies show that the benefits of colonoscopies in seniors over 75 are often outweighed by the risks. In fact, for every 1,000 colonoscopies performed on seniors, only a small percentage results in life-saving benefits, while many others suffer serious complications. Consider the case of Maria, a 75-year-old who had no symptoms of colon cancer but was encouraged to get a routine colonoscopy. During the procedure, she suffered a bowel perforation and spent weeks recovering in the hospital. After reviewing her case, her doctor found no reason to have performed the colonoscopy, as she had no history of colon cancer or symptoms. For most seniors, less invasive tests like stool-based screening tests such as the FIT test are safer alternatives. Finally, we need to discuss full-body CT scans. These scans are sometimes marketed as part of an executive health package or as a preventive measure. While the goal is to catch diseases like cancer early, the reality is that full-body CT scans come with significant risks. They expose the body to high doses of ionizing radiation, which has been linked to an increased risk of cancer. The scans often uncover harmless conditions like benign nodules or cysts, which can trigger a series of follow-up tests, biopsies, and even unnecessary surgeries. A 2023 study found that full-body CT scans are responsible for a significant number of cancer cases, putting seniors at a higher risk of developing cancer from the scan itself than from the conditions it aims to detect. Take the case of Robert, an 80-year-old man who felt great and had no symptoms. He decided to undergo a full-body scan during a private clinic checkup. The scan revealed a small nodule in his lung, which led to a series of follow-up tests, including a biopsy that caused a collapsed lung. Thankfully, the nodule was benign, but Robert spent weeks recovering from the procedure. Experts recommend that full-body CT scans should only be done in symptomatic individuals and not as a general screening tool for healthy seniors. In conclusion, many routine tests and checkups for seniors may seem harmless. They can lead to unnecessary procedures, complications, and even harm. It's important to be proactive and ask your doctor whether a test is truly necessary, especially if you have no symptoms. Listen to your body, focus on maintaining a healthy lifestyle, and choose your checkups wisely. After all, sometimes less is more when it comes to healthcare.